Good evening, medicos. Welcome back to our channel, Medical Students Corner. Myself, Dr. Krishneswari. We were discussing in our channel the symptoms of neurology, is it not? So, the videos were posted in such a way that there will be 2 neurology classes followed by one Malayalam session, which is useful for all. But some of my viewers and some of my dear students suggested that it will be good if you upload some ECG classes also. So our channel is planning to upload basics of ECG sessions on every Sundays. So we will not be uploading so much on ECG, we will be uploading it part by part. So it will be easy for all of you to understand. If you are having any suggestions regarding this, please let me know. You can put in the comment box. Hoping for your support again. Once again, thank you for your support. So, we will start with ECG today. So, every Sunday there will be ECG class uploading. Okay. So, in the first few sessions in Sundays, we will be dealing with some of the basic anatomy and physiology of circulatory system, which is very important in reading an ECG. We will not be going to the details of the surface anatomy and physiology of circulatory system. We will be dealing only with the important things which is necessary in reading an ECG. Okay, so today in this first Sunday of ECG class, first ECG class, we will be dealing with the surface marking of heart, which is very important as far as ECG is concerned. So, we will start with it. Please be careful. Okay. So, surface marking of the heart. Regarding the surface marking of heart, there are only 4 points which we should remember. So, there will be 4 points, and by connecting these 4 points, we will be getting the surface marking of the heart. Okay. So, we'll go to the surface marking of the heart directly. So, this is sternum. Okay. Sternum. Okay. This is body of sternum, and this is xiphoid process. So, this is clavicle or collarbone, clavicle or collarbone, and first rib which will be what? In the posterior side of the clavicle, and this is the sternal angle where manubrium sternae joins with the body of the sternum. It's the sternal angle. It is also known as angle of Louis. So how we will be identifying the sternal angle? So by palpating the chest, what we will be feeling is we will have the sternal notch here in between the 2 clavicles, is it not? Medial part of the clavicle, there will be sternal notch. You palpate just behind that, you will be feeling a ridge, and this ridge is corresponding to the sternal angle. Okay, so from you palpate on the lateral side of the sternal angle, the rib or the bony part you are feeling is the second rib. Okay, second rib. So, second rib, third rib, fourth rib, fifth rib, sixth rib. Okay, these are the position of the ribs. The ribs are connected to the sternum by means of costal cartilage. You know that, by means of costal cartilage. By means of costal cartilage. Next thing we should remember is the space between the 2 ribs is known as intercostal space. Intercostal space. So, the space between the first and second rib is the first intercostal space. Second and third is second intercostal space. 3 and 4 is third intercostal space. 4 and 5 is fourth, and 5 and 6 is fifth intercostal space. These are the basic things you should be understanding regarding the surface marking of the heart. So now we are going to mark the points. Okay, so first point. So this is right side and this is left side. This is right side and this is left side. So The first point we should remember is the point in the lower border of second left costal cartilage. Second left costal cartilage, which is second left costal cartilage, which is 1.5 inches away from the median plane. 1.5 inches away from the median plane. So what is the median plane? Median plane runs along the center of the sternum. Okay, runs along the center of the sternum. It constitutes the median plane. Okay, so it will be 1.5 inches away from the median plane. This is the first point. Okay, then second point. Second point is the point on the upper border of the right third costal cartilage. Right third costal cartilage, which is 1 inch away from the median plane. Okay, 1 inch away from the median plane. Next, third point. Third point is also on the right side. So it is right costal cartilage, sixth costal cartilage, right sixth costal cartilage, which is 1 inch away from its joining with the sternum. Okay, 1 inch away from the joining with the sternum. This both are median plane. Okay, next is joining with the sternum. So sixth costal cartilage 1 inch away from joining with the sternum. Next is fourth point. It is in the fifth intercostal space, left fifth intercostal space, which is 3.5 inch away, 3.5 inches away from the median plane. 3.5 inches away from the median plane. So these are the 4 points. One is in the left side, one in the lower border of second left costal cartilage, 1.5 inch away from the median plane. Second, upper border of right third costal cartilage, which is 1 inch away from the median plane. Next, sixth costal cartilage, right side sixth costal cartilage, upper border 1 inch away from its joining with the sternum. And fourth is fifth left intercostal space, 3.5 inches away from the median plane. So you join all these 4 points. Okay. So we are joining all these 4 points and we get the surface marking of heart. You understand? Very, very easy. You remember all these 4 points, which is very important while reading. Not reading an ECG, while keeping the position of leads in a ECG. So we'll see the border of the heart also. So suppose we understand that heart is in this position, is it not? Heart will be like this. It will be in this position. So this constitutes the right atrium, this constitutes the left ventricle, and this forms the right ventricle. Okay, so how many chambers are there in heart? We all know that there are 4 chambers. So right atrium, right ventricle, left ventricle. We cannot see the left atrium because it is in the posterior side of the heart. Okay, so there are 4 borders of heart. One is superior border, inferior border, right border, left border. You understand? Superior border, inferior border, right border, left border. So superior border, it is formed by right atrium and left atrium along with the great vessels. Okay, great vessels which is arising from the chambers of the heart. That is, from the right ventricle arises the pulmonary trunk and left ventricle arises the arch of aorta. So right atrium, left atrium and great vessels. Then right side, right border of the heart is formed by right atrium. Okay, then inferior border, it is formed by right ventricle and left ventricle. Then left border, it is formed by left ventricle and a part of left atrium also, or left auricle. Okay, this forms the borders of the heart. And then there are 5 surfaces of the heart. 5 surfaces of the heart. One is sternocostal surface. Okay, sternocostal surface, that is the anterior surface. Then there is a posterior surface which forms the base of the heart, and it is formed by left atrium. Then there is apex of the heart which is formed by left ventricle. Then there are pulmonary surfaces. So this is regarding the basic anatomy, and surface marking of the heart, which is very important as far as ECG is concerned. You understand? So we will uploading the video part by part. Okay, small topics we will be uploading, so it will be easy for you to understand. If you are having any suggestions, please let me know. You can put it in the comment box. So hope you understand. So we will have another happier ECG session also. Thank you for your support. If you are happy with our session, you are happy with our channel, please subscribe. Please share to your friends. Happy learning. Thank you so much.